I fell down the stairs, a full flight of stairs at home. And it took 2 years to progress to the point where I really couldn't walk. I couldn't move my left hip. And my chiropractor tried to move it for me and said, "You're so immobile that I think you're going to need to see a surgeon about this." I worked for a major airline loading aircraft in the cargo bins down on all fours and twisting and turning, pulling, pushing things. It got to the point where I just couldn't stand it. I decided, because I have a 5-year-old at home, that to stay active with him as he's going to grow, that if I'm not going to be active, how is this going to affect him? And I really was sidelined. I was completely sedentary.
Keith came to me with a really long-standing history of hip pain. He wasn't really sure of the reason for it, and once we took x-rays, we saw that he unfortunately had really bad arthritis. With Keith, we decided to perform an anterior hip replacement surgery, which is how I perform almost all hip replacement surgeries now. And that is really because the success rate and the rapid recovery that patients have with that technique.
When I met Dr. Sanders for the first time, we sat and chatted about home life and activities and what this would entail, because I was pretty concerned, to say the least, about replacing a body part. He says, really nothing to be concerned about with my background and our techniques and our support. You're going to be fine.
The really most gratifying thing for myself as well as my patients is how quickly that their pain resolves. Almost immediately they notice that their pain is completely gone after the surgery. Now they do still have some muscle soreness from the surgery, and the muscles are still tight because over the years of this whole process, the muscle has tightened up because of decreased motion and mobility of the hip joint. Now during the recovery process, then we have to work on some therapy. We have to progress their mobility, have to essentially learn how to re-walk again, and that process takes a few weeks.
Life is great now because I'm able to walk, where I really couldn't walk before. I had great difficulty even in getting up. My left hip is good to go.